Have you learned something today? Okay, so right now what I want you to do, everybody, I want you to write these things. What will you start doing? What will you stop doing? And what will you continue to do? As we draw to a close. All right. Umejifunza kitu eh? Sawa, let's wind up. Tuna dakika kama 5 tu nimalize. Sasa I want to ask you a question. Okay, kwanza what are your top 3 strengths hapa? Collaboration, commitment, and values. Safi. So your personal brand lives where your strength and values and passions meet. Yani hivyo vitatu vinavyokutana, that's your branding. Okay? Tuwapigie makofi mengi. So in your groups, maybe this can be individual work. I want you to imagine, I'm giving you a scenario. I want you to imagine LinkedIn, our Instagram, our Twitter. Introduce yourself, our Twitter. They've given you a free space. I want each person to draft a social media post, 3 to 4 sentences that will communicate your personal brand professionally and authentically. Based on these 3 things: who you are, what you stand for, and the value you bring. You can discuss with your team members, ili wakupe ideas if possible, because I want it to be conversational. I'm only giving you 1 minute to draft a social media post, kwa sababu I think most of you don't take 5 minutes kutengeneza post on social media. It's a quick one. So draft it. Include who you are, what you stand for, and the value that you bring. Okay? $30 more seconds. Alafu ukishamaliza kudraft, tuna post. Sema tuna post. Tuna post. 10 more seconds. Nani yuko tayari kupost? Nikupe bando. Who wants to post? Kimsingi tumemaliza. I just want you, kwa sababu si ndo posting ndo nani ya mwisho inakuja pale na posti. Ukiposti pale unaenda unatulia tulia unasubiria comments. Who wants to post? Nobody's ready? Au hamna bando? Anybody? You wanna share? You wanna post? Post.
I am a medical student with integrity, passionate about social impact with content creation skills and ability to work in a team.
Pigeni makofi mengi sana. Umesahau kitu jamani. Amesahau nini? Write it down. If you don't define your brand, the world will define it for you. So take control of your story. I'm going to say that one more time. If you don't define your brand, the world will define it for you. So you must take control of your story. You must take control of your story. The way you package, present, and project yourself to the world. Ladies and gentlemen, did you learn something today? Did you learn something? All right. Can I invite everybody to stand? Be upstanding. Mshike jirani yako mkono. Aya. Say what I say, but and do what I say, okay? Say what I say and do what I say. So if I say jump left, you jump left and say it, okay? Are you ready? Let's do it. Jump left. Jump right. Jump forward. Jump back. Good. Now, right now, say what I say, but do the opposite. Okay? So if I say jump left, you say jump left, but you jump right. Okay? Are you ready? Let's do it. Jump left. Jump right. Jump back. Don't jump. Stand up. Sit down. Stand up. All right, tujipigie makofi. Ladies and gentlemen, thank you very much. That was my time. Let's connect. Let's connect and learn on socials. My name is Jonathan Ndali. If you need mentorship, if you need coaching, please reach out. Thank you very much. Asante sana.
Thank you so much. Thank you so much. Hands of applause to him. Thank you so much. Wasn't that wonderful? Was it wonderful? How many have learned something? How many? Can one person just raise and say, Mimi, nimejifunza hichi siku ya leo? Anyone? Any volunteer? Great.
My name is Cynthia Masuka. Today what I've learned is we all make an impact into the community, but one thing that we don't do is we don't show what we do. So I've learned to show what we do.
Thank you so much. So we'll just have 5 minutes because we are out of time. 5 minutes. Anyone with a question to Mr. Jonathan? Ooh, okay. Okay. So I'm gonna take only 2 questions, and please be as straightforward as you can. I'm gonna take one question from Genevieve and the other gentleman over there. Mr. Jonathan, these are your questions. Karibu.
Thank you. Okay, my question is, first of all, thank you for your presentation. It was amazing. I've learned a lot of things that are new in my life, and it has added value. I've been here before, so this is like my second time, and I came here specifically because I saw your post, because you're going to present today. So I said, okay, I'm going to leave everything and come here.
Thank you.
And I had 2 questions, but I'm given just a chance to ask one. So my question was on part of consistency, on the elements of personal branding. On part of consistency, you said that one should have one thing that he or she is going to be consistent with while posting, but in the reality of our daily endeavors that we are all doing, we are all capable of doing multiple things, and there are people who are like multiple talented. So how are these people going to juggle their things in the social media? Like today, for example, myself, I'm a gender equality enthusiast. I'm also a public health enthusiast. So how am I going to juggle these things together in my social media in order for my brand to have a certain statement? Also, my second question, just can I please ask also this one? Okay, so on the part of authenticity, they say that in other trainings somewhere, I'm also sure that other people might have heard this thing, that you should find a role model and get inspired from that role model, which means like you should find her mannerism, the way she speaks, how she wears and everything, and you should start like kind of getting inspired and do things like the way your role model is doing, like conducting your life the way your role model is doing. Now, my question is, how do we define that thin line between copying and being inspired by that role model? So how am I going to say, like, this is the limit, that if I go beyond this, I'll be copying this person, and if I do not go to that boundary, I'll just be, this is just pure inspiration. How do I differentiate the two?
All right. So I think I will start with trust real and people trust consistency. Okay. So I think when I was beginning my session, I said, I'm glad I was not born a cockroach, right? And each one of us, God created you uniquely. Yani wewe haufanani hata na jirani yako, hata mkiwa mapacha, right? So obviously you have something special and unique about yourself. So it is important in your learning and in your mimicking. So we all mimic somebody. There's somebody as a role model, unamwangalia, unamappreciate. Don't lose yourself. Kwa hiyo, you will be able not to lose yourself only if you have discovered who you are first before you start mimicking somebody else. Because you need to know your strength, you need to know your values, you need to know your passions. Kuna assignment moja nilitoa, your strength, your values, and your what? Your passions. Where these three meet, swali lako la kwanza sasa, this is your brand. Kwa hiyo kama you are a human right activist and you are a medical doctor, you find a way to fuse them. Nina mdogo wangu, she's a medical doctor. Yuko kwenye clinic moja ya IVF. She's a stylist. Anapenda kuvaa, anapenda kutokelezea. Guess what? She has blended the two, being a medical doctor and a stylish. Wengi mtakuwa mnamfahamu on social media na stylish med. Right? So angalia the two things that you're doing, how can you merge them together? Na to correct you, sikusema you need to, very good question. Quitting my very high paying job at the very top of my career, leaving Johannesburg, Sandton, South Africa, to come and employ myself. You know how people quit their jobs when things are not going well or mshahara mdogo? I quit my job at the very top of my career. Na niko Sandton, South Africa. Beautiful, luxurious apartment, director, all the privileges you know, and so forth and so on. But I was like, you know what? I need to build my brand more than I'm building this other brand. That was a risk because you don't know whether it's going to work or not. But it didn't happen overnight. I've always been maintaining my brand. It's just that was the final hammer on the nail, and it made the difference, and that's why I'm here today. Thank you very much. Sitaki kupoteza muda maana mwakani unaweza kusema yule mkaka msimualike yule brandi mkubwa lakini anapoteza muda. So thank you guys. Let's connect kwenye social medias. Can I share my number? Yes. So if you need to reach out for more, my number is 0625 552161. 0625 552161. 0625 552161. My name is Jonathan Ndali. When you Google that, you will see. Let's connect on LinkedIn, social media, Facebook, Instagram. I have a YouTube channel. You can get more of this. I think at a session baadaye naweza nikaiweka huko, and TikTok and so forth and so on. Thank you and God bless you. Asanteni sana Tanzania Health Summit for having me. Can we clap hands for them? God bless you.
Thank you so much, Mr. Jonathan. Personally, I really wish we had the whole day with you. And I think this is a challenge to THS, that perhaps we just need 1 or 2 speakers to spend a day, because looking at the program, we still have a lot to learn from various speakers. So once again, as Mr. Jonathan is going to attend at the work, let's clap hands for him again. 1, 2, 3. Do you remember the clap we had in the morning? Can we do that? 1, 2, 3, let's go. Okay, people just forgot. Let's do it seriously. 1, 2, 3. Na moja kama wabunge. Okay, thank you so much. So, since we're out of time, we are going to jump straight to the next session. And I would like to welcome a data scientist and machine learning expert at Emerging Technologies for Health, ETH, Muhas, with experience in applying machine learning to healthcare challenges. She has led breast cancer detection research using AI and improving accuracy with TensorFlow and Keras models. She holds a bachelor in computer engineering and IT from UDSM with an exchange semester at KTH University in Sweden. She is passionate about leveraging AI for innovation education, and impactful problem solving. Ladies and gentlemen, this is no other than Miss Paula Mill Makafu. Correct me if I've not pronounced your name well. Hands of applause to her. Wanawake vigelegele. Karibu sana. Thank you. So as we are waiting for Madam to connect, the cameraman is here. So since speakers have other work to attend to, I would like to invite all the speakers on the stage to have a general picture. So all the speakers of today, let's have a quick photo session, then we'll continue with the session. Mr. Jonathan, karibu. Felista Bwana, karibu. Miss Paula Mili, karibu. Dr. Julieta, karibu. Okay, the steering committee, get ready for the photo session.
Guys, do you know what is this? This is called branding.
Okay, we'll be joined by the steering committee. Karibu sana. Amazing. Okay, the creative committee, karibuni pia mjumuike kwenye picha. Karibu sana. Maria, welcome. I'll also join. Okay, and few representatives, please don't leave the stage yet. The committee you can leave, but the speakers remain. Can we just have like 10 representatives from the YOCAB team? Okay. Thank you so much. We'll have another photo session at the end of this session. Madam, karibu sana.
Hello, everyone. Let me wait for everyone to settle. So basically, nimeona that was a very good introduction. So simply, my name is Paula Mili Makafu, and everyone gets to wonder, why does my name seem to be so long? Actually, that's one name, Mili, and it just stands for millennium. So that's the basic meaning. Yeah, so, yeah, of course, I'm a data scientist. I have a background in computer engineering. Nilipata pale UDSM. And currently, I'm working at labs, Ziko Muhas, kule Mloganzila. And we're working on different projects, health in cooperation with AI. So I've worked with breast cancer detection, but we're still working on. And right now, I'm just working with data analysis from health data za Zanzibar. We're just trying to analyze some health issues now, to create models of prediction for medications and everything around health. Yeah, so we're going to start our session. Today, we're going to learn about AI. AI has been something that we always hear, and with can someone tell me and I understand anything from AI, Ninini? Like, what's AI? Basically, we can start from there. So just pass around and I can just pass it. Yes.
For my understanding, AI, it's a short form, artificial intelligence. It means that it's something that is created from collection of datas, a lot of datas, and then it has been trained to be intelligent. It can tell something, it can give answer like a human being, but sometimes more than a human being. That's what I understand AI.
Yes, yes, thank you very much. So basically, it's just, we're born with natural intelligence, ambayo tumeumbiwa nayo, but with artificial intelligence, we're just trying to put that intelligence in a machine. That's why it's called artificial, because it's not original, we're just putting it inside a machine. Sasa, you can see the screen, right? So, you all know ChatGPT. So, I wrote a prompt. I was like, hello chat, I have a presentation at an event called Tanzania Health Summit, where I'm to present in front of about 140 youth leaders. I want to welcome them with a rap song. Please help me with one. So this will be our icebreaker. And na mimi kuna mtu hapa anajua kurap. So we'll follow with the lines, right? Naomba mtu a rap hapo according to ChatGPT alivyotufanyia. Anyone? Yes, thank you. Yeah. We can give
Go girly, go girly.
You can see?
Yeah. Ngoja nisogee hapo mbele nione vizuri. Yo. Yo. Welcome to the summit. Let's ignite the flame. Tanzanian youth leaders, remember the name. We're here for the health innovators for inside. Building strong features, yeah, we're, clap your hands once. Clap your hands twice. Hey, together we can change the world, unite for life. For Dar es Salaam to Arusha town, Dodoma to Mwanza, we're holding it down. Young minds rising, the future is near. Leaders of tomorrow, we are ready here. So let's stand tall, speak loud, make your vision clear. The summit is ours, let's own this year. Together in health, together we grow. Tanzanian youth leaders, let's steal that show.
Thank you very much. What's your name?
Dr. Esther.
Thank you, Dr. Esther. That was so nice. Did you expect that to come from her? Yes. Koni a common rapper around you, mnamjua. Anyways, so we'll move on. So leo I'll teach you AI tools. Mr. Jonathan, I'll teach about branding and how to post, how to make yourself visible. So Mimi, I'm not that good at that area, but I think I can help you with some tools ambazo zitawa assist with everything that he has been teaching you. Sawa? So how many AI tools ambazo mnazijua, or any AI powered tools that you know, or you can tell me any AI, whatever you used in the last 24 hours? Yes? She used Copilot. Yes? 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 Thank you. Unasoma nini? Oh, biomedical engineering. I was just like, wow, what a divergence from a doctor to coding. Yeah, thank you. Mwingine? Pardon? See space for research. Anyone else? Wow. Nyuma, somebody? Yes? For presentations. Higher. So, let me switch on to my. Yeah, so I just wrote a few hapa, which are just common, and any other AI powered. We have ChatGPT, Copilot, Duolingo AI, we have Canva, we have Otter, we have Notion, which is also powered by AI. We have Lovable, Netflix, recommendations in social medias, and all that. Sawa? Lakini, to interact with any AI, hasa hizi chatbots, kama ChatGPT, Perplexity, I don't know, Gemini, whatsoever, there is something called a prompt. Si tunajua maana ya prompt wote? Yeah, exactly. So the prompt is just what you instruct your AI to do, inakupa kitu unachotaka. So simply, tunajua kwamba tunavo prompt, the clear you prompt, unapata better results. Like if you feed it garbage, unapata nini? Garbage. Kwa sababu tunavoelewa kwamba AI ni machine learning. It keeps on learning. So the more content unaipa ielewe zaidi, the more it's going to give you more answers. Kwa kama ukipa kitu vaga ambacho hakieleweki, atakupa tu majibu ambayo yako guess. Ndio maana kuna wakati wengine unakuta mnasema, ChatGPT hana akili. Si nini namuuliza hiki anajibu vingine. It's just because of the simple prompts that we use, zinakuwa haziko clear. So, we just have basically a simple formula for it on how to prompt. Oh, I feel like inakatakata. Kuna moment you can't hear me? No, it's clear, right? Okay. So, we just have a role, unaipa the task, context, format, na tone. Ukisema role, kwa mfano, you're telling it, you are an HR recruiter, hiyo ni role, unasema task, labda nataka upitie hii CV as an HR recruiter, una recruiter workers in a context kwamba labda ni wanafunzi or whatever. Format, sasa hapo ita depend na prompt. Lakini simply ukisema format kama hapa nilivyosema, it can be I want my result in terms of essay, I want it as a list or as a tweet, I want whatever, is it a rap song as we did hivyo. And tone, unaweza ukasema I want it to sound motivational, I want it to sound serious or emotional, lovely, whatever. So that's all you have to instruct when you're putting your prompts. Kwa hiyo, I hope you all have devices. Yeah, okay. So we're going to do some little thing hapa. Kwa mfano, nikaandika prompt yangu kwa ChatGPT. Nikaandika write about leadership. ChatGPT will write, lakini ataandika a lot of generalization hapo sio. It's different from nikiandika a prompt. You're a motivational speaker. Write a 2-minute speech for university students about leadership using a friendly and inspiring tone with 3 practical tips. Sawa? That's a very different one. Sasa, I want, so I'll divide tasks hapa. I'll like this side, like this row hapa. Mtatumia ChatGPT. Then hapa, we can use Gemini. Then huku, we'll use Perplexity. Sawa? Then with ChatGPT ninataka from this prompts I've written hapa mtatengeneza a good prompt. Huku mtaandika hiyo write my LinkedIn bio. You will rephrase that to a very strong prompt. Hapa you'll make my CV better. So ninaamini in your devices you have your CVs. So you attach your CV, then you write a good prompt from here make my CV better. Alafu huku mwisho we will write a research report from my TB project. So for huku I'm not going to attach anything because I'm sure we don't have that. Lakini I just want the prompt. Tumeelewana? Hamjaelewa? Okay, nimeambia tujaelewa. Hizi ni prompt nimeziweka. Haioni? Sorry. I didn't know you couldn't see anything. Sabu kutoka is it PPT? No, I'm just wondering. Presentation I can just have. So, sorry for that. Nitaanza from the prompt formula. So we are going to use this formula to make better the prompts za kule mbele. Sawa? Nilisema we are starting with the role. Unaipa wewe ni nani ChatGPT sasa hivi. Labda wewe ni mwanamuziki sasa hivi, au wewe ni producer, au ni mwanafunzi. Then task unataka ifanye nini? In what context? Labda kama niko kwenye mazingira ya aina hii, niko mbele za watu 100 na ngapi, something like that. Then format, nataka hiyo iwe in form of speech, iwe in terms of research, iwe PDF or whatever. Na whatever it's going to produce, iwe kwenye tone flani. Nikasema awe serious, au iwe motivational, whatever tone that you want. Hapo tumeelewana tukasema kwenye be specific hapo sasa. Izi who ni unampa nani, for what, how long, hivyo, in what style, set the format, hivyo essay, list, tweet, afu utadefine your tone. Then, nikakupa example ya bad prompt. Like, I just tell ChatGPT, write about leadership. That's a bad prompt. Lakini nikienda kwenye good prompt, tukiangalia ile formula yetu, you're a motivational speaker, write a 2-minute speech for university students about leadership using a friendly and inspiring tone with 3 practical tips. Hapo tuko sawa? Haya. Nikasema we're going to divide ourselves. Huku tutajaribu different chatbots. Hapa tutatumia ChatGPT, hapa tutaandika Gemini AI, kule tutatumia Perplexity. Hapo tuko sawa? Yeah. Si tuna devices internet connection? Hatuna? Ipo Okay, great. Sasa, from my left, nyie mtadeal na hii prompt ya write my LinkedIn bio. So these are bad prompts. I want a phrase iwe a good prompt kwa kutumia formula yetu. Yes. Then hapa katikati with Gemini, we're going to change the make my CV better. So, to make it easy, tutafanya hivi, because we're in tables, tunaweza tuka work as a group, sio? It's going to be easier. Same as here na huku. Kwa anyone with a CV, anaweza kai-upload, then tutengeneze a good prompt ya kutengeneza CV better using the formula. Alafu the last column huko, iyo ya research report. Make a good prompt ya research report. Kwa like maybe utafocus a report iwe whatever you're going to do. Sawa, but iwe a good prompt ambayo any chatbot itakuelewa. Then you have one person from a table atatusomea prompt yake alivyo rephrase. If you need help, mtasema there. Gemini. Okay, great. Are we good? How are you keeping up? When I see a notebook and not Gemini, how hauna internet? Hotspot. It. Angalia kwa wizi. Okay. Okay, hello. Aya, so we have Team Chat, Team Gemini na Perplexity. I hope we are done, eh? Sawa? So nitasimamisha, anyone can volunteer from ChatGPT atuambie alivyoweza kuirephrase vizuri the prompts. Anyone from this side? Yes? Mike, sorry. Yes, read us your new prompt.
Okay, first, I'm Haitham from Zanzibar. Okay. I am a committed dental student and a social activist with a clear vision for advancing the well-being of my country, passionate about leadership and a community empowerment. I aim to merge a professional
Nice. Memskia? That was so clear. Yes? Yes, you can. Just stand and keep on. Ngoja akupe microphone. You're also dealing na hii CV, right?
Yeah.
Okay.
I mean, LinkedIn bio. Specifically, my name is Lauren. I am the CEO of Tanzania Health Summit. Write my LinkedIn bio that will explain a brief summary of my professionalism, my role to the global space, and make a professional tone and explain in 5 sentences.
Wow.
I am the CEO of Tanzania Health Summit, a premier platform advancing healthcare dialogue and innovation in Africa. I bring together government, private sector, academia, and civil society to drive impactful solutions to health systems. My work focuses on strengthening partnerships, promoting knowledge and exchange, and aligning local priorities with global health agendas. Through strategic leadership, I position Tanzania and Africa as key players in the global health space.
Wow. Meona, like her miss out anything, lakini ana add very good words on what you have written. You have seen, eh? Aya, na hapa tuamie Gemini. Yes.
Okay. Our CV. So we prompt it like this. I'm a mediator in word format.
Tabia a certain. Sababu ni CV inabadilika kutokana na nini na apply.
Yes, hi Gemini. I'm Ramadhani Ali Hamisi, medical student. I'm applying for position program coordinator in SRHR project. Make my CV better at international standard. Export Word document with strong motivational to my interviewer. Then I attach the PDF CV.
Thank you very much. That is so nice. Hiya. We're getting something, right? Backbenchers. Yes.
You're a medical student. So this is what my prompt looks like. Hi Gemini, I'm Shahneez, a second-year medical student. Please review it. Please review I would like your help to make my CV shine. Please review it and suggest ways to make it clearer, more engaging, and highlight my achievements and skills in a way that feels genuine and professional. I wanted to stand out to recruiters without signing over the top and reflect who I really am.
Yeah. Wow. Thank you very much. That is so nice. Sasa nimeambiwa like time is skipping up. Perplexity tutasoma prompt zetu tukipata muda. So I'll move on to an AI tool nilotaka niwafundishe leo. But basically I can add on something hapa. With every prompt, for it to learn more, unaweza ukamwambia ask me 5 questions ili you understand more. Like whatever you have been missing, ask me the questions nikujibu, alafu mwisho utengeneze a very good bio. Sinaelewa eh? So, mnavyoendelea hapo, you can just ask, mkamwambia hapo Gemini whatever, ask me 5 questions first ili kupata more content about me, ili usimiss out anything in any prompt that you do. Then apart from that, ChatGPT has a disadvantage who make mistakes. Here, we all know that. Kwa hiyo, kuna maswali, they can just be normal questions. Just a normal prompt. Ukamuuliza, are you sure? Have you ever tried that? Yes. Anakuwa, kuna kita, sorry, whatever anachoandika. So with every prompt, make sure unampush, are you sure? Anajibu, are you sure? That's when you're going to get your clarity. Then, tulivyosema, kuna mtu amekusikia notebook LM? Yes? Yes, so we're just going to do a simple demonstration ya hiyo. So this is just platform ya Google ambayo inaweza kukusaidia wewe kwenye your researches, kwenye material. So it's basically kama your personal notebook. Unaweza ukawa una a lot of materials to read, kitabu, inakusaidia for summarization, a better way of learning. So the difference ya hii from a normal chatbot ChatGPT, even with a good prompt, atakupa just generalization of things. Sawa? Lakini hii ina dig deep with whatever material wewe ambayo umeipa. So this can also work with something called GPT agents. Unazijua? So when I talk about agents, zile zinakuwa zina specify kama ukisema GPT-5 agent. Nikisema ChatGPT nimpe CV yangu, aeleze from my CV, basically atasoma tu what's on my CV. Lakini nikimpa agent, anaweza akaload even for 22 minutes trying to discover each and every detail from my CV. Sawa? Yeah, so we can have that demonstration. Lakini let's start sasa na notebook LM. So, this notebook LM ina different features kama podcast, video generation, this up. By the way, have you gotten something? Have we enjoyed that? Yeah, thank you very much for participating. So it's just a simple game. Na hakika wengi mtakuwa mnaijua. It's called Badu Badu. It's all about stretching. Sawa? Yeah. So when I say Badu Badu, we put our hands up. If I say mistake, you sit. Higher. Badu Badu is up. Nimesema how? Uniangalia mimi. Okay. Now we are going to start seriously. 1, 2, 3. Badu Badu. Badu Badu. Sit. Badu Badu.
Madam, kuna watu wana cheat a lot.
If you make a mistake, just sit. Badu Badu. Unakaa kumengajua hiyo. Ba. Badu Badu. Badu Badu. Ba. Ba. Badu Badu. Badu Badu. Yeah, that's great. Thank you very much.
More hands of applause to Mani tumejifunza. Okay, personally, I always see AI and digital stuffs very complex. But then from this, I see, because most of my friends, they do coding, you know, they're into AI, they're doing computer science and all that. But for me, it has always been hard. Checkup. Do you remember in the morning I said, if you're feeling great, you do like this, thumbs up. If you don't feel, read her biography yourself. So, experience in health promotion as a group at the University of Memphis. Program Officer for the National School Health and Nutrition Program at the Ministry of Health Tanzania, and Executive Secretary of the Medical Women Association of Tanzania, MEWATA. She holds an MD from MUHAS and a postgraduate certificate in leadership and public management from Boy State University with core interest in adolescent sexual and reproductive health and global health diplomacy. She contributes to key national adolescent health documents and programs. She is deeply health and well-being of adolescent and youth knowledge healthcare system. Close to her. Makofi na vigelegele.
Brand ukipata umata
Makofi na vigelegele.
Brand ukipata umata Jonathan mimi, lakini yote ni mema, you know, and that's why I was a YOCAB 2021, the second cohort, the YOCAB 2021, the second cohort. So mimi nikiwa naongea huwa napenda kila mtu anisikilize, kwa sababu nami niliwahi kusikiliza na mimi nikapata kibali cha kuwa hapa nilipo. Sawa eh? So nashukuru sana organizing committee led by Dr. Pili for inviting me to speak to you, very vibrant, energetic, talented young leaders. I'm looking forward to learning from you, but also because nilivyokuwa invited, I sat down like 2 hours to write what I want to talk to you as young leaders. After 2, and I'm very happy the moderator amenipaisha, but I thank God. That's who I am and what I'm doing. So I want to speak directly to you, a young leader in this room, who sometimes quietly you ask yourself, innovator, a public, oh, do I deserve to be here? So let me tell you this, like, with all the conviction, you belong and you belong enough. But keep daring, we keep leading. So losing that election didn't stop me. It shaped me. It taught me resilience, strategic thinking, and most importantly, self-belief. But you know what? I have said my relationship journey ilianza msalato, not at all. It was also shaped by my personal lived experience. After completing my primary school, when I was about to join my secondary school studies, my father wanted I to get married at the age of 14. So he said, I won't forget his words at that time. In my village, there was no girl had chances in Form 2. And those who made it to Form 4, they failed with Division 4 or 0. So my father said, I cannot even take you to secondary school because I haven't seen anything out of a girl child in this village. But trust me, I had a dream. Hello? I wanted to become a doctor so I could empower young girls with right information on sexual and reproductive health. My secondary school fees, and the rest is history. So today, I'm very proud to be the first female medical doctor in my village. Even more powerful, many young girls back home are now studying hard, dreaming of universities, and daring to aim higher because they saw that everything is possible. So when I go back to the village, huwa sijitengi. Ninaingia mtaani, navaa kama wao, ninakaa na mabinti kijijini, ninaongea nao. Kwa sababu nimezaliwa pale, and my parents wako pale. Kwa nikiwa naongea nao, and that's the power of authenticity. Hello? Yes! Ameongea vizuri Dr. Jonathan. Na muda mchache wananiangalia kwa jicho la kunifukuza hapa. So that experience is what sparkled my calling, not just to be a doctor, but to be a public health leader. So along the way, as I have said, I volunteered a lot in conferences, through MUHAS, THS, nishaikuwa volunteer before being a YOCAB member, mambo kama hayo. But let me tell you one thing, kwamba my career in public health is not as easy as you think. Unajua nikiuliza mtu anayesoma pa medicine nataka mistake kutibu, nataka ni public health specialist. It's not easy, my young sisters and brothers. It requires resilience, consistency, focus, sacrifice, and surrounding yourself with mentors and friends who push you forward even when you want to give up. In summary, public health, ameuliza swali zuri Genevieve, kwamba unaweza kaa ni mtu unatamani kufanya vitu vingi sana. How do you brand yourself? How do you do what? How do you compile things? That was a question, right? Guys, public health is very wide, eh? Ina mambo mengi, a lot of domains. Kwa hiyo ukikaa chini, choose wisely. Sawa? Choose with purpose. Choose with values. Huwezi kufanya kila kitu katika public health. But what you want to do, kaa chini, meandika your passion, meandika your whatever, stick on that. It won't be an easy journey, but one day you'll be proud of yourself. Hello? So, I want to talk a bit more of how I brand myself in social media. Nani ananifuatilia kwenye social media? Oh, a good number. Thank you so much. Guys, usidharau kazi unaoifanya, eh? So whatever you do, usidanganye sana. You know, AI tumefundishwa inadanganya vitu vingi sana. Thank you so Paula for teaching us how to do it. Lakini make sure kwamba hata AI inakueleza who you are. You are telling yourself in LinkedIn kwamba you can be a public speaker, afu kitu sehemu unaanza kukosa confidence. Shame on you. So you should command AI talk about really who you are. Sawa viongozi, eh? Tumelewana? Yes. So use well your Instagram, your LinkedIn posts, andika vizuri. So, and lessons from me to you young people. The first thing, be intentional. Know what values and causes you want to be known for. And secondly, stay authentic. People follow stories and not just statistics. Don't brand a lot of numbers, you know, eh? Lakini make sure the numbers tally na your authenticity, lakini the purpose that lives inside you, na mwisho wa siku jenga legacy. Na conclude ni kwamba start where you are. Young leaders, watu tuna volunteer jamani. When you are called somewhere to volunteer, usianze kuhesabu pesa. Tumeelewana Na niwa alinifundisha kitu kimoja. Do you know Dr. Ntuli Kapologwe? Akaniambia, when you brand yourself, when you build your brand, pesa itakufuata. Mimi nilikuwa sivagi suti, lakini siku hizi nikaenda kwenye kuongea, navaa kasuti. Tumeelewana Kwa you change as you go along. Tumeelewana Start by volunteering, guys. Msitwe sehemu I don't know niwaambieje. Then use your voice. When you have something to talk about, mimi ninamtolea mfano tu kwa sababu mdogo wangu huyu yuko tamu sana, mwana kwenye Instagram account yake anaanza kaamka asubuhi akaelezea kitu tu in a funny way, lakini napata knowledge na kufuatilia mdogo wangu. Na kitu kingine ni kwamba unaweza kuwa na post kitu unapata a few likes ukaanza kukata tamaa. Hapana. Likes sio sawa sawa na watu wanavyokufollow. Tumeelewana Watu wanakufollow. And lastly, press on. Keep pressing. Uko shuleni, usikae tu na career anatomy. There are a lot to do outside of anatomy and physiology. There are a lot to do outside of, I don't know, wanaotoka UDSM, computer, whatever. Connect. Learn from people. Usifanye mjuaji. Kuna watu kabisa na watu wakubwa lakini they're still learning. They seek for knowledge. They attend conferences. They attend gatherings. So, press on with your ideas. Even when people laugh at them, press on. Hello? Press on with your passion, even when resources feel scarce. Press on with your leadership, even the journey feels lonely. Trust me, leadership sio kazi ndogo. Mkitoka hapa, I wish to meet you maybe after 2 to 3 years. Nitakuuliza, how do you feel yourself? Kuna vitu amua kuvi-innovate, watu hawata kukubali. Tumeelewana Msikate tamaa. Press on and press on, because your journey matters, your voice matters, and the future of Africa is waiting for what only you can bring to the table. Thank you so much for listening.
Thank you so much. More hands of applause to her, please. Jamani, mmechoka. Okay, so let's do this very quick. I need 5 people, 5 volunteers hapa. Chap. Hivi ndo hamtopata hela. 5 volunteers, please. 5 volunteers? Okay, you can come. Yes. Just great, amazing. 1, 2. So get it up. 1, 2, 3, 4, 5, 6, 7. Interesting. I love the volunteering spirit. Madam Juliet, umeona? They're very proactive. Kuvolunteer hivi. So we are going to do a very quick game. Sawa? Takuwa napitisha mic. Unaitaja nchi. Lakini the only rule, you don't have to repeat nchi ambayo ameisema mwenzako. And it has to be very quick. Ukitaka kufikiria, you go back seat. Okay? Tunaanza. Tumeelewana? Have we understood? Have we? Okay, 1, 2, 3.
Tanzania.
China.
Canada. France. South Korea.
Gambia. Asia.
Thank you. It was nice having you. Okay, tunaendelea.
Jamaica.
Argentina. Sweden. Zambia.
USA.
Japan.
Thank you. Let's go.
Austria.
Tena, thank you. It was nice having you. Okay.
Eritrea.
Brazil.
Colombia.
Denmark.
Chile.
Scotland.
Thank you. It was nice having you. Okay.
Netherlands. Jamaica.
Nigeria.
Canada. Seychelles.
Uganda.
Nigeria. Tanzania.
Thank you. It was nice having you. Like, I'm not going chronologically, so you have to have those countries in your mind. Sawa? Okay, who is team ladies? Who is voting that she will win? Who is voting the man will win? Okay, can we hype the lady? Can we hype the man? Okay, let's see who will win.
Malaysia, Ghana, Cuba, DRC, Morocco.
Okay, let's repeat this. Sarah, I am not logically, so you have to have those countries in mind, okay? Are you ready? Okay, let's go.
Kazakhstan,
Ethiopia,
Kenya,
Uganda,
Namibia,
Malawi,
Zimbabwe, Kenya.
Mozambique.
Okay, they're both winners. Thank you so much. Do we have other volunteers who want to do the same? Do we have? Okay, we'll do it next time. So who is ready for our last session? Who is ready? Are you ready to hear our next speaker? Are you excited? I am excited too. So our next speaker is a public health specialist with masters in health promotion and a background in nursing and midwifery. With over 30 years of leadership in sexual and reproductive health and rights programming, she has worked across government, NGOs, and the United Nations system in Tanzania. Most recently, she spent 17 years at UNFPA as a multi-stakeholder coordination to improve dialogue innovation around SRHR. Oh God, now I'm saying the name, Jesus. So she is a committed advocate for youth, sexual health and reproductive rights, and she believes that inclusive technology-driven solutions are key to bringing sexual and reproductive health services within reach of all. She has been honored with awards recognizing her life-saving impact and for pioneering innovations in sexual rights and reproductive rights. Ladies and gentlemen, I'm representing to you Felista Bwana. Amependeza hajapendeza? Karibu sana.
You allow me to stand? Nisipendi kukaa. Hapa kwenye podium ni sawa? Jamani, habari za mchana. Habari za mchana. Mbona watu hawaitiki huko nyuma? Habari za mchana. Nimefurahi na jua nini ni English full or English Swahili or what? Both. Actually nimefurahi, unajua ukiambiwa kwenda kuongea na vijana afu ni mzee, si ndio? Unaanza kusema nijiposition vipi, si ndio? Lakini sababu nimeombwa kusema mambo machache na mengine nimesikia previous speaker amesema, so I think I'm happy that I'll be connecting from her presentation and probably what you have learned in the morning. So, but I would like actually to thank the president of Tanzania Health Summit, but the coordinator of YOCAB, and every one of you who are here, particularly you young leaders who have, you are attending this forum. I think this is it the 6th year? Yes, okay. So I'm really deeply honored to be here because probably someone else could have come to speak, but then they chose to invite me. I'm grateful. And actually, I'm also aware that it is 6 years since YOCAB became more than a training forum. That's what I understand. It is now a catalyst for young leadership in Tanzania health sector. And this theme now, today, the theme that says empowering young youth leaders, building bold personal brands, and harnessing AI for impact in digital world. When I saw it, I was like, okay, we are just getting closer to the world. So this theme, actually, we have a rare chance of combining the personal growth with the sector transformation. We know that even our health sector is transforming itself. It might be slowly, it might be quicker, it depends where and how and who do you work with. But this theme also is an opportunity not just to imagine the future, but to begin building it today. So I believe that whatever you have learned today, it is not about having trained and then it ends up there, no, but imagining the future, which now it is begins today when you have gone through different sessions. So I would like to share. I was asking Pili that what kind of story I want to give. Because said you can also share your experience and your journey. I said, okay, let me try. Actually, I always appreciate my grandfather. People have different stories, but I appreciate my grandfather because I was born, I think he was the one who took care of me because my father died when I was 2.5 years. So my grandfather took all the responsibility himself and my grandmother. But he was a very strong person who, I don't know what he saw in me, but what I understand, by age 5, my grandfather was very proud to teach me the Bible and want me to stand before everyone in the church and start narrating like the whole chapter of the book of Genesis, like chapter 1. And then I would say, without even feeling bad and feeling that I'm young, 5, at 5. And my grandfather was very proud. At age 8, I was like his personal secretary. At age 8, my grandfather would say, come, read all the letters I have received in my office and respond. Will ask me how I managed to do it. I don't know. Because today, if you tell me to read 5 things and then come and start remembering each one of those things, I have to go back to that document every now and then to refer. But that time it was not that, because I will read the letters and he will tell me, in this letter, write this and that and that. No computer, no typewriter, your head. So, and like 10 letters. And then he'll go to sleep. So during that time, I have to write each letter according to what he said. And I can tell you that I don't know where I got that capacity, I don't know. But I was able to write correctly. If there's some few changes, probably 1 letter or 2. But the rest, he will sign off and then it will be posted. That's how I started, and it was like, okay. They seem to be small things. But I came to learn later on that they were building me as a courageous person, and also, you know, they build also your capacity, the thinking capacity. So initially I was taking them like small things. See, you move with the Babu here and there. Babu said, "Mke wangu," you know. But later on, I learned that it was something installed in me, which probably I couldn't have been if I didn't get someone from the start. So I always encourage women, parents, not only women, encourage your child. Don't discourage your child. Since when even if it's 1 year, let her or him do things which they'll make him or her grow well. But most of the time you find people, they can insult, they can say anything bad thing to the child. You don't know the impact you're putting to that child. And sometimes many people suffer, they are not able to do this and that, they fear. Me, I have worked in different areas, as the moderator was saying, but all the places I have worked, from the government, at the early age of my profession, because I studied nursing and midwifery, I didn't want that profession. I didn't want anything, from the health sector when I was young. What I wanted is to be like a marketer, public speaking things, sometimes the air hostess, I wanted many things, you see. And I was very sharp. But then my grandfather said, no, you have to go and do nursing. Nursing, how am I going to manage? I don't know if I'll manage. But I went. In the past, we have to respect what the parents will suggest. These days are a bit different. You have option and choices. But for us, it was not option and choices. Sindio jamani? So I went. The first, I think, going to clinical classroom was okay because I was good in science from high school. But now telling me about going to care someone who is sick was very tough for me. But I told myself that let me just do it. Because in my heart, I have that helping spirit. Helping people, it was within me. Then I said, let me just try. But at least I will not work on clinicals for 10 years. Of course, I did it. And I will tell you why, what things sustained me in that journey. Because if you want to change this and that, you have to remain focused. You don't get outside your plan. No. It doesn't matter you're changing this or that, but you remain focused on what you planned from the start. Hello. Good afternoon. So then I think I finished school. I started working. I think I started in Shinyanga. Then for 8 months, then I went back to Mwanza. Then the leaders, they saw the leadership in me. You know, there are people who will be with you in your journey. If you get good people to facilitate your journey, you're very lucky. So I was also lucky. If you find people who are not good, actually, they will discourage you. And your journey might be very difficult. Me, I always say, even now I have retired, I was saying, my that quickly, and I don't fear. For me, I don't fear. So people are like, okay, those who decided to hate, you let them hate. You don't need to challenge them with what they do, but okay. So in life, there is challenges. There's challenges. And then you have that moment where even you establish something. There's always not like there's always success. No. There's challenges. I face challenges, but for me, my belief is that when challenge comes, I have to find solution. Even at home, they know. Even my relative, they know. Tough times, when everybody doesn't know what to do. Thank you. So when that tough times, this is my relative, they were like, we don't know what to do here and there. They said, bring this fixer. I'm like a fixer of things. Because for me, I don't fear. And I will give you one example that when I lost my husband, was like in a road accident, almost 30 years ago. I was young. I was still young, but I had 3 kids. Everybody was panicking. Of course, I got shocked, but I'm like, life has to continue in any way. It's not a good thing. It's not that I'm happy. I'm not happy because I got confused. But you still remain to be a mother. You still remain to be a professional, to go to work. You still remain to ensure the kids are going to school. You still remain to do other community things. si ndio? So now some people are feeling that this lady ana moyo mgumu, huyu msichana I don't think hata anajali. Sio kwamba sijali, najali, lakini lazima usimame imara ili maisha yaendelee, si ndio hivyo? Maisha yaendelee. Kwa hiyo I was able to navigate, na bado na kazi kuendelea, na kusoma, nasoma, siachi kusoma, sawa? Naambiwa na 10 minutes, sina maana, nilikuwa najua nina muda karefu kidogo, lakini wananiambia na 10 minutes. Labda niseme I'm going to na piki vitu vichache, lakini taongezi pillars kwa sababu they are very important. Kama kijana, if you want to navigate within the profession or outside the profession, na uweze kuendelea mbele bila kukatishwa na mtu mwingine wala kuonekana kwamba huwezi. Ya kwanza kabisa, clarity of the purpose. Unaona? Yani why, the why should be at the center of whatever you want to do. Unaona? Kwa nini unataka kufanya kazi fulani? Kwa nini unataka ku bring change to this community? Why do you want to do that? Unaona? Ukiwa na hiyo iko hapo, the why, the center of your plans, utaweza. Kwa hiyo mimi, that is my pillar. I have used that clarity of the purpose. Kwa nini? Why? The why is always in me, in my mind. Kwa nini nafanya kitu fulani? Kwa nini nafanya kitu fulani? Kuna siku nilisaidia zamani nikiwa msichana bado. Nilikuwa na miaka kama 28. Nilimsaidia mtu, nilimzalisha mwanamke barabarani. Alikuwa ameachwa na everybody. Yaani amekuwa ni maskini, hana uwezo hata wa kusogea mbele. Katembea kwa miguu akachoka. Mnajua wengi wenu madaktari, si ndio? Nilivyosikia watu wanaita, nikasema Mungu wangu. That time HIV kwenye peak. Sikufikiria HIV, sikujifikiria mimi. Niliangalia tu nikasema Mungu wangu, huyu mama anakufa na mtoto atakufa. Nilichoenda, sikuwa na gloves, nikaenda kumzalisha yule mama. Nikamzalisha, nikajua tu kwamba nikishamtolea mtoto tutatulia kidogo. Na wasimulia kwa Kiswahili kwa sababu inanoga story kwenye Kiswahili. Sasa kwa nikakimbia hospitalini kwenda kuomba wheelchair, kuomba na seti ya kuzalishia. Nikarudi, nikanawa sasa na mikono. Nikavaa gloves. Sikuwa habari ya HIV nilikumbuka baadaye sana kwamba hivi kama mama ana HIV. Nikasema Mungu, hapa nilikuwa nafanya huduma, naomba unilinde. Sasa kumbe yule mama akaja kunifanya nikawa fame. Why? Mama aliokotwa na watu ambao walikuwa ni watu wa serikali, walikuwa wamekuja Mwanza tu kivyao. Wameenda kumwambia mkuu wa mkoa. Mimi kesho yake naitwa kwa mkuu wa mkoa. Nikaogopa. Msichana anaitwa kwa mkuu wa mkoa, je, kanyaga huko, alafu unapita kwenye red carpet. Unasema, kuna nini? Nilipofika ndo naambiwa ni ile story ya yule mama. Nishaisahau na story ya yule mama. From that, jina likatembea, nikapata recognition Wizara ya Afya, waziri akaniita, waziri mkuu, that time sio mzee Malechela. Bungeni, ukienda kwenye hazard za bunge za mwaka 92, my name is there. Mona, lakini that humanity, kitendo tu cha wewe kusema ngoja nifanye, si ndio? Kwa sababu mara nyingi sana tunataka kufanya kwa sababu fulani kwamba nitapewa hela, nitafanya nini. No, usifanye hivyo. Ukifanya hivyo safari inakuwa ngumu. Kingine, continuous learning. Mimi bwana sichokaji kusoma. Hiyo ni pila yangu ya pili. I don't get, yani sichoki kusoma hata kidogo. Na hata sasa hivi hapa na 62 nimeretire. Nimeretire miezi michache iliyopita. Lakini hapa nimesha consult professor, nataka kufanya PhD. Yes. Kwa sababu yani mtu asikudanganye kwamba wewe umeshakuwa mzee, hii akili ukizeesha inazeeka. Lakini akili ukishughulisha, you will always be intelligent. You will always be perfect. Utaendelea. Kwa mimi hapa nataka ukinisikia tena siku nyingine tukikutana ndani ya miaka 3 minne, nitakuwa nishapata PhD. Kwa sababu na muda nao. Kwa hiyo learn vitu vingi. Mimi ukiniuliza vitu nilivyosoma, hakuna mtu anajua kama hata na background ya kwenye medical huko. Nilishakutana na watu London wakaniambiaje, mimi Felisa, we thought you are marketer. Wengi wananiassociate huko kwa sababu mimi naongea, mimi najua lobbying strategy. Kwa hiyo wengi sana huwa hawani associate kabisa hata siku moja huko. Hata nikisema vipi. Kwa hiyo please continue learning. Usistiki kulearn vitu unavyovijua tu au unavyovipenda. Learn na vigumu. Nitakwambia kwa nini. Wakati mimi nimejiengage kwenye innovation, ofisini hakuna aliyekuwa nataka, from my boss to the last person, hakuna. Mimi nikasema jamani, hivi amuoni kama business as usual inachosha? Si ndio? But I can tell you, when I started, nobody was even listening. Nobody even wanted to know. Lakini mimi nikasema, this is difficult thing for me. Lakini nikaanza kusoma. I started reading, consulting. Baada ya muda, mbona innovation tunakuwa champion? Ndio maana I'm saying I'm a champion of innovation. Na nashukuru 3 weeks ago nimepata award ya watu wa Sahara, mnawajua Sahara Ventures. Sahara Ventures wamenipa awards, tulipewa na naibu waziri. Nafikiri mimi na Ambassador Ami na mtu mwingine mmoja simfahamu sana. Ambassador Ami namjua. Why? It is a patronage legacy award. Wanasema kwamba ulitutoa mahali ambapo we are nothing. Walieleza. Nikamshukuru Mungu kwamba nothing is wasted. Mradi tu umekubali kusaidia, umekubali kulearn, umekubali kujitoa muhanga. Because people are explaining their grievance, how the seniors are treating them. When you are young, seniors unaokuta kazini, they see you as a useless person. Madaktari ambao wanakuwa frustrated, anasema, "Kwa nini?" Senior doctor kamjibu anachojua. Pale na yeye akiwa mdogo, kwa nini usibu-encourage hunako wewe kama wewe? Lakini I think people fear challenge, si ndio? Watu wana fear kwamba this one is going to grow to replace me. But in any way, he's going to replace you. You're going to get old. If you don't die, you're going to be old, you will retire. Si ndio? And that's the fact of life. Si ndio jamani? Lakini mimi ule mjadala nilisema, wanasema seniors, "Sis, we want to learn from you, but you don't want us." It was very sad, very painful that day. But this is the thing I'm also saying, that wakubwa, yani zile setback zipo, usiziogope. Usiziogope, sawa? Usiziogope kwa sababu one setback when it comes, it opens another way for you to think different. That's why I love innovation. If this one doesn't work, something else will work. Si ndio jamani? Hello. Yes. Cha tano ambacho mimi huwa ni pila yangu is credible personal brand. Najua in the morning you have talked about the personal brand. Si ndio? Unaona? Why people trust you? Ni vitu gani ambavyo vinakubeba wewe? If I have to say quickly kwamba nikuulize, what is your personal brand? Na hivi nimesoma asubuhi. Anyone who want to say personal brand yake anaweza kuisema. Yeyote tu. Nani anataka kusema? Asubuhi nimesoma. Yes. Yes, please. You are? Thank you. Mmesikia? Mwingine? Yes.
My name is Mariam Survey. I am a conversation curator, well known as a moderator, MC, but I'm also a mental health advocate, building wellness within Hub Initiative, a non-government organization that promotes awareness on mental health, builds capacity, and pioneers for mental health to young people as far as mental health is concerned in Africa and globally at large.
Okay. Okay. So when mimi hii pila naiangalia pia in terms of your reputation. Your reputation matters a lot. Sindio? Consistency in integrity. Sindio? Quality work. Tuna bahati mbaya in this country, people don't care. That one I can tell you, hatu kinamsha usingizini. Majority ya watu, they don't care. Mwambie mtu akuandikie report. Yeye kwake is about finishing. But it's not about finishing. It's about quality finish. Sindio jamani? If you start, if you yani ukistand na hivyo vitu, you stand with integrity, ethics, sindio? Quality work, respect, consistently. Sio kwamba leo nimekuja Tanzania Health Summit, you embrace those things. Kwa sababu sio zako, ukitoka tu nje hapo, unaachana nazo, unaweza kukuta unatukana na watu, unaweza kukuta unafanya chochote, si ndio? Lakini you need to embrace those things. Hizo ndio brand kwa mtu. Mimi nawaambia pili anaweza kana nijua zaidi, coordinator wetu hapa. Mimi kazini kokote nilikofanya, kokote hata nilikosoma, hakuna mtu ambaye atasema inapokuja kwenye quality work, bosi mpaka mtu achia anasema dada Felista. Tena sasa Watanzania kwa sababu wapendi kuchoshwa, dada Felista na complication. Yaani wataisha kukuambia hivyo, lakini why? Kwa sababu umeleta report ambayo mimi naona sentences hazieleweki, Kiingereza kiko kushoto na wewe ulisema unajua Kiingereza. Halafu umeandika content hazieleweki, fonts hazijulikani, hazina alignment yoyote. Nitairudisha kwamba hii hatupeleki mahali na mimi sitaki kupata kazi ya ziada. You have to fanya kazi ya ziada, then I have to start myself bila kukupa wewe. Unaona mpaka hapo? Kwa hiyo wanasemaje kwa Kiswahili? Unajiainisha ni kwa jiainisha unataka kujitambulisha vipi? Je, wewe ni mtu wa quality work? Una good integrity, ethics? Sisi nilivyokuwa nafanya UN, tunafanya na tunafanya kiapo. Na integrity kila mwaka tunafanya. Lakini unashangaa the same thing ambazo zimesema kwa integrity na ethics. Dakika 2 aliyefanya na cheti kapewa, anafanya against it. Mimi sasa najiuliza, why did you do this examination? Why did you study? Kwa nini usingeacha tu? Sasa unajua kazini wanataka. Sasa tukifanya kwa kuwa kazini wanataka, si ndio? Haitusaidii. Hiyo branding haiwezi kuwa na nafasi. Si ndio wapendwa? Kwa hiyo mimi hizo ni pillars ambazo kusema kweli namshukuru Mungu sana zimenipeleka mbali. Tasema kidogo kuhusu muda najua nilikuwa na dakika 30 sijui. Najua sitaki kuitumia yote. Sidhani kama nimeimaliza. Lakini kwa nini hii theme? Why this theme? Si tunaelewa why this theme? Kwa nini hii theme ipo? Labda asubuhi mliongea. Asubuhi hamjaongea kweli kuhusu why? Kwa hiyo theme ikiwepo lazima iwe na sababu. Why this theme? Eti wapendwa. Kwanza, unataka kusema? Yes, karibu. Mpe mic huyu kaka. Why this theme? Kwa nini huu mwaka una hii theme?
Okay, my name is Evarist Focus Malengo. I graduated from Zumbi University.
Yes.
This theme imekuja in a manner that we are in a transformative move from human-centered services in health care to machine or robotical artificial intelligence use in healthcare services. So it is about us learning how to integrate our human knowledge in context with our environment so that we can offer better services to the citizens.
Thank you. Thank you so much. This is a good one. Kuna kingine ambacho mtu anataka kusema? Yes, please. Yes.
Theme of the conference, but also the theme of the YOCAB.
Yes.
They're all interlinking because now we are going to the digital health or digital technology. That we need to use data as what speaking our performance of everything we are doing in the world in healthcare systems. So when we unite data and technology to increase healthcare coverage, it means that the data will direct us on decision making in policy. But when I come to YOCABs, we as a youth, we as a future of healthcare for today and future generation, we need to leverage in digital literacy. So we need to understand how we can build our authentic personal branding by using digital platforms. That's what SIM means.
Thank you so much. Great. Sindio, tumpe na makofi. Yes. Very true. Kwa sababu digital health market in Tanzania value yake imekuwa kubwa, sindio? Inakadiriwa kuwa kama milioni ngapi USD? Digital market in Tanzania value yake sasa hivi according to 2025 data. Hapana. Ni kama dola milioni 191 milioni 192. That's a digital health in Tanzania. Ambapo over half of it ni mambo ya care. So unajua ni care. Kwa hiyo ina maana kwamba utaiangalia, lakini what is more ambayo inachukua nafasi kubwa ni digital treatment and care. Sasa hivi unaona tunafanya telemedicine, tunafanya kitu gani? So the telemedicine na other care zinachukua 88 million USD. Unaona? Kwa hiyo ina maana kwamba whatever small percent inabaki ni kwa vitu vingine katika health. Sawa jamani? Kwa this is the reason theme ya summit lakini pia ya YOCAB inasisitiza kuhusu mambo ya na digital transformation. Lakini kingine ambacho ni muhimu pia ni issue ya kwanza, kuna issue ya gap katika data. Si ndio tunajua? Kuna gap katika vituo vyetu. Wangapi wameshawahi kufika au kufanya kazi katika rural health facilities? Okay, wachache. Thank you. Si mnajua hali ilivyo. Kwa sababu people still use manual in reporting kama 70%, si ndio? Sasa with that, na wakati kuna growing digital market, si ndio, na innovation dunia nzima, yani you cannot expect sisi tunaendelea kubaki nyuma, lakini the way we move is not very proper. Kwa hiyo kuna a lot of discrepancy in terms of data, unaona. Lakini kingine ni issue ya connectivity, electricity. Kila siku umeme umekatika, kila siku sio kitu gani, kila siku hivi nini, na most of the digital equipment whatever zinahitaji sana umeme, si ndio? Chache ambazo hazihitaji, na hii nafikiri wanatulipotia watu kila mahali. Lakini demographic health nini hii ya kuripoti indicator hii DHIS2, si ndio, na human resource information system zetu bado ni system ambazo zinakuwa, they are growing. Kwanza correctness ya data katika hiyo bado ni issue. Ndio bana tukiuliza, can the ministry give us probably this data? Leo huyu anaweza kupa data hii, mwingine akakupa data hii, mwingine ukafikia mahali you don't know which data to nini present. Lakini sasa haya yote yanamaanishaje kwetu? Kwanza tunaona kabisa kwamba pamoja na changamoto, we see that the health sector is ripe for innovation and digitalization. Si ndio? Tunakubali wote. Is ripe kwa sababu wao wana strategy. Tunajua strategy yao ya innovation na digital. There is a strategy of the government overall, lakini pia nitamtafutia. Hajua hata value yake. Ndio maana nimesema kwamba they have to see that hii ni opportunity. Yani pamoja kwamba kuna challenge, lakini we have to. Asante Juliet. Kwa sababu gani? Mimi nilikuwa naambia watu siku moja, wakaniambia, where did you get this? Nikamwambia vitu mbona viko online? But people are lazy sometimes, my dear. People don't want to kuchokonoa kutafuta, si ndio? We have to. Na sisi kama vijana, mimi na inspire nyinyi kwa sababu mimi ni mzee, lakini bado nakutafutanaga na hiyo. Mimi nimwambia mtu juzi kwamba wewe kama unafikiri mimi sijui AI, wewe ndio utazeeka. Kwa sababu mimi I use a lot of the AI things na uzee wangu. Kwa sababu usijizeeshe bila sababu. Sasa for you being kijana, you have to be far ahead of me. Si ndio jamani? Far hivi vitu vinakufacilitate. Lakini sasa watu siku hizi anaenda kucopy kwenye chat box, unaona, kwenye GPT. Halafu anaweka hivyo context ambayo hata sio ya Tanzania. Unasema hii context sio ya nchi. Why are you putting this? No, yani tushughulishe akili. Shughulisha akili vijana wangu. Si ndio jamani? Yes, tushughulishe. Kwa hiyo why this theme is important, kwa sababu this is an opportunity, kwa sababu the government matches bado kuna resistance. Nadhani wale walioshiriki summit ya mwaka jana Zanzibar, mimi nilikuwa na facilitate kwenye forum ya UNFPA ambayo ilikuwa na deal na maternal health na innovation. Yaani mkurugenzi wa COSTECH alisema, na uzuri watu wote wa serikali walikuwa kwenye hiyo forum, people are difficult, especially health and education. Yani they're the one that they don't want change. Na hicho mtakutana nacho. That's why it's important, hii theme ya mwaka huu, muiangalie what will be your entry point katika changamoto ambazo unaziona kabisa hizi nitakutana nazo. Si ndio? Lakini we have to navigate. Sio kama tunabaki hatu navigate, hapana. Kwa hiyo tunatumia hiki tunachokielewa na tunachokisikia kuhakikisha kwamba we still want to be part of change for this country. Si ndio jamani? Kwa hiyo mimi labda ni shauri tu, nataka kumalizia. Unapotaka kuanza kitu, it's like you are a change agent, si ndio? You don't need to do big things. Unaweza kaanza na small things, si ndio? Nafikiri mtakuwa labda asubuhi pia mmeambiwa, si ndio? You don't need to have a very perfect idea. No. Si ndio? You don't need to have a perfect idea. Perfect idea itakuja. Mimi na innovation ambayo tulianzishaga, tulianza na watu ambao tulivyoanza nao tulikuwa na hela, lakini tufanye nini? Tukaanza kama ilikuwa online na tumia internet nini, lakini tunataka solution, healthcare workers capacity building for rural setting. Umeme wanao hawana. Tukasema hii ngumu. Tukarudi tablet bado utahitaji kuchaji, batteries, what. Mwisho tukakaa tukadiscuss na watu walikuwa New York huko, tukasema jamani, can we do something? Mimi hapa nyumbani napigwa vita na wenzangu wote. Bwana Felista, remove this activity in the plan. This the third year, things are not happening. Na mimi nikangangania. Yaani wakati mwingine lazima ikinganganizi. Nikasema it will work. Wait a minute. Mwaka wa 3 tukaja na solution tofauti. The same concept, unaona, na purpose imebaki kwa ile ile, lakini tukasema this is now a projector ambayo iko ni multimedia kadogodogo kama simu tu, lakini tumeupload all the content for a life saving, for maternal and child health, tumeziweka mle. Zimewekwa na wenzetu huko New York. Yaani kile tulivyokilaunch siko ni lala usingizi. 3 years. Sasa kama unakata tamaa, it will not work. Unaona? It will not work. Hako kamezalisha innovation nyingine zote kwenye ofisi niliyokuwa nafanya kazi ya UNFPA. Baada ya hapo tukaendelea na vingine ambapo sasa hivi tunafanya au wanafanya. So is important kwamba unaweza kuanza na kitu kadogo, katapata upinzani, lakini start with that. Lakini pia unahitaji kuwa bold na uwe na vision. Si ndio jamani? Uwe bold na uwe na vision on whatever you want to do. Ukisema you want big things, the project ni kubwa. Mimi na vijana ambao we started with them, nimeona leo wako hapo chini na bandara afya intelligence. Hivi humu ndani wamo? Eti nani? Hawamo humu ndani. Yaani ilikuwa ni wako kwenye program yetu tuna program innovation accelerator. I think that was the 3rd group. Lakini wameimaji, wakatoka pale wakabreak, wakazalishwa afya intelligence, ikazalishwa sijui nini hapo, wanatengeneza sasa hivi safety belt za ku present postpartum hemorrhage. They have gone far. Lakini people wanaweza na kitu kadogo. What about this? What about that? Unaona? So you start small, si ndio? Hata ukiamua ende kijijini kwenu, walikuwa nasema Juliet, kijijini huko mimi umenifurahisha sana kwa sababu go back to the village. Umeshasoma, umeelewa? Ukaangalia kuna nini, issues za kule kwenye village ni nini jamani? Zipo, unaweza kuzisort kwa kutumia technology, kwa kutumia innovation, na innovation nyingine sio technology, si mnajua? Not all the innovations are tech. No, some of them they are not tech. Lakini ni doing things very different. Sawa jamani? Halafu nataka kumalizia tu. Kamwisho vitu vingine nimesikia vikisemwa, especially kwenye leadership. Nataka tuangalie leadership resilience na what can leave lasting impact. Si ndio? kwanza tukubaliane kwamba leadership is service, si ndio? Tunakubali? Leadership is service. Ukitaka kufanya tofauti hiyo, unataka kuwa boss, si ndio? Sasa boss ni tofauti, lakini leader anaonyeshaga njia wengine waweze kwenda. Kwa hiyo tukijua leadership is service, so if you expect professionalism, show it that you want to be a leader within the professional. Kama ni daktari but you want to be leader, show them. Kama ni accountant, you want to be leader there, show it, si ndio? Lakini if you expect collaboration, you have to initiate. So lazima watu wengine waanzishe. Na kama una expect innovation, then you need to deploy it. Si ndio jamani? Cha pili, resilience. Tunaisikia resilience kila siku. Resilience is built daily. Sawa? Resilience is built daily. Every small challenge is a challenge to learn. Sawa? Unaweza kuifikiria ni kitu kidogo, lakini every small challenge ni challenge inayokupa wewe hatua nyingine katika kujifunza, si ndio? Ndio. Inaweza kawa hamna pesa, na innovator wengi ukiwasikiliza is about no money, no funding, where are the donors? Lakini donors pia, they trust if you can manage their money. Kama they are not assured of that, hakuna donor ambaye anaweza kukupa pesa. Lakini pesa zipo. Pesa zipo. Zipo kwa donors, pesa zipo kwenye community, pesa zipo kwenye serikali, but how do you brand yourself? Si ndio? How do you brand your ideas, and how do you present your ideas as well? Sawa wapendwa? Lakini mimi nilikuwa naambia watu kwenye forum nyingine ya innovation mwezi mmoja uliopita. Wanasema tunapataje hela? Wanaulizana. Hela zipo. Ni wewe tu una brand vipi? Agenda je inakubalika na priority? Iko in line with the government? Inakubalika internationally? Si ndio? Yani you cannot come with an idea ambayo haiko tested kokote, hafa iko kwenye priority ya serikali. It will be difficult. Si ndio? Kwa hiyo resilience inaweza ikaje, but it is built every day, because small challenge inakupa hatua ya kujifunza. Lakini pia lasting impact, kwa mfano from system change, not just individual project. Hizi unahitaji kujua kwamba ni muhimu kubadilisha policy na mifumo, si ndio? Systems, ili vitu vibadilike, we need to advocate for changes in policy, changes in the system itself. Kwa mfano sasa hivi I said kwamba alikuwa nasema mkurugenzi siku hiyo wa COSTECH last year kwenye summit hii, education na health, na sisi wengi ni afya, si ndio? Au kuna watu tofauti? Wengi ni afya. Kwa sababu kama nyinyi wengi ni afya, yani mkae tayari kwamba afya ni ngumu, challenge ni ngumu, kwa sababu wengi hawapendi kubadilika. Unaweza kukuta within the Ministry of Health, idara hii ina embrace innovation na digitalization very easily. Ukaenda the same ministry, ukaenda kitengo hiki, hawataki hata kusikia chochote. Hawataki hata kusikia chochote. Shahidi yangu atakuwa pili. Tulikuwa na project ambayo tumehangaikia sana kupata hizo pesa. Wamegoma, muda umepoteza. Mimi mpaka nimestaafu, nimeacha, have no idea sasa itakuwa imefika wapi. Lakini just things which zina faida kwa watu, lakini wameamua kusema haziwezi. Yani mtu anaamua hataki cha innovation, hataki cha kutumia technology ambacho mara nyingi ni cheap. Mara nyingi ni cheap. Innovation haziko expensive hivyo. Lakini anataka pesa itakayomkalisha kwenye workshop. Sasa mnisaidie. Hivi ukalisha watu kwenye workshop na kufanya ukatengeneza kimfumo ambacho watu wana access the same content za material, yuko huko sio Buswelu, yuko sio wapi huko, niambieni kipi ya gari? Yani kumkalisha mtu kwenye workshop labda Dar es Salaam, zingatia kuna transportation, kuna meals, kuna accommodation, whatever. What is cheap? Nisaidie nyewe hapa. What is cheap? Yani lakini sasa watu wakisema hawataki unafanyaje? So you have to be ready, kwa sababu kwenye sekta ya afya na elimu ndio zinaonekana ngumu katika mabadiliko. Kwa sasa inabidi nyinyi sasa msichoke, msiumie, start with something small ambayo itawa convince si ndio? It will make people, okay, hata wizarani waone, aha, okay, can we start with reviewing the policy? Lakini ujitahidi that time to read all the policies. Na uiangalie ile, kwa sababu kuna strategy nzuri sana ya digitalization ya taifa. Ipo. Umeona? Na Wizara ya Afya inayo pia ya kwake. Sasa try that. Soma kwanza zile one zinasema nini, and then come up with your idea. Yamkini where you are staying or where you come from kuna changamoto. Women are dying, children are dying, au kuna high infectious diseases, unataka kuja na wazo, si ndio? So try, but you have to go pole pole ukiwa na wewe unajua mifumo inasemaje, si ndio? Sasa mimi labda namalizia hapa, moderator wangu nisamee. Nina washukuru sana. And then I am just looking forward, nitamuuliza coordinator kwamba at least baada ya mwezi wangapi, kwa sababu wamesoma vitu vingi tangu asubuhi, si ndio? I'll be more than happy baada ya mwezi kusikia hata watano tu they have come up with some projects, they have come with innovative project ambazo wanataka hata kama ni kwenye wilaya yake, si ndio? Je, tunajengaje hiyo prototype? Tunaifanya iwe MVP? Tunaifanyaje? Si ndio? Yani at least something small, come up with that small, ili watu waanze kuona kwamba kumbe hii mafundisho ya mwaka huu kuna kitu kimetokea. Si ndio pili? I'm very sure if you come up with something, yani elimu hii isipotee tu ambayo mmesoma tangu asubuhi. Mimi leo nimekuwa kama mshereheshaji tu. Si ndio? Nimesoma na wa mwisho nimemkuta Dr. Juliet. Lakini I can tell you, start with something small. Something small. Uanze tu, lakini study, understand, and useme kwamba okay, hiki hapa kiweza kikasaidia. Si ndio wapendwa? Lakini mimi nawatia moyo kabisa, kwa sababu as young people, yani wewe you are not, nani aliniambia akasema kwamba ni agent wa nini wa kesho. Mimi hilo neno huwa sipendagi kulitumia. Vijana nyie msiambie habari ya kesho. You are the today change agent. Mnafahamu hiyo? Today, yani usiambie habari ya kesho. It's not about kesho. Si ndio jamani? Basi mimi naomba niishie hapo. Niwashukuru sana. Kama kuna maswali, Mariamu utaniambia. But otherwise, I'm so happy to see you, and I hope to see you in the next few months. Kama tunakutania Dar, tunakutania wapi? Thank you very much. Karibuni.
Asante sana Madam Felista, asante kwa nondo nzuri kabisa. Vijana tumesikia? Vijana tumeelewa? Okay, basi naomba tusimame kwanza kabla sijakaribisha watu wa maswali kwa Madam Julieta pamoja na Felista. Naomba tusimame tuchangamke kidogo. Yes. Anyone with an icebreaker? Yes, come Baraka. Very quick, halafu tunamalizia maswali.
Okay. Kwa nisimame hapa. Tufanye hivi. Afshika hapa. Nikiimba katumbo mama katumbo. Unaruka juu sawa? Are together? Katumbo mama katumbo. Tatizo lako ni moja. Tumeelewana eh? Alafu baada ya hapo tutaimba katumbo katumbo ndi. Sasa you do katumbo katumbo ndi katumbo katumbo ndi. Together eh? Katumbo mama katumbo. Tatizo lako ni moja. Ukila wewe hushibi. Mbona mluki, twende juu. Katumbo mama katumbo. Tatizo lako ni moja. Ukila wewe hushibi. Katumbo katumbo ndi katumbo katumbo ndi katumbo katumbo ndi.
Thank you so much, Baraka. At least I have spotted few dancers in the room, but the rest are just like me. Thank you so much. We have heard from Madam Julieta, we have heard from Madam Felista, and because of time, I thought it would be wise to combine all the questions. So are there people with questions to Madam Julieta with Madam Felista? Just raise your hand so that I can know how many people we have in the room. 1, 2. We have 2 questions. The volunteer, please help me with the mic. We'll start with the gentleman there and go to the other gentleman at the back. And please pose your question specifically if it's to Madam Julieta or if it's to Madam Felista. Karibu sana.
Yes, hello. Good afternoon. I'm Samson Sindani from UDSM, Mchasimbea. So my question goes direct to Dr. Julieta Tibesiaga. As we have seen, you have provided us with a very empowering and motivating journey towards your career pathway from secondary school up to this level where you are right now. So my question is, what motivates you? What motivates you? What gives you the energy and the drive to keep going on? Like, what gives you the fuel to keep the fire in you, keep blooming and keep lightening? Because as you have shared, there has been a lot of obstacles, a lot of words being said, lots of challenges, but still you're here today with us, trying to build in us, try to plant in us the same spirit that you have endured throughout your career. So what gives you the will to keep going on? What motivates you? What's your purpose?
Okay, thank you. Madam Julieta, hopefully you have heard the question. We'll listen your question as well, then we'll go to the speakers for them to answer.
Thank you. I am Joseph Peter Masawe, the Executive Director of the youth-led organization by the name Without Non-Communicable Diseases Initiative. Thank you, the presenters, for what you presented to us. But I have a question to both of you, as all of us inside here are leaders, and in one way or the other, we are inspired by the stage you are. But a question, it is, what are the skills, what are potential skills that you wish you could know earlier that aided you to be in this part? Both of you can help us outlining maybe this skill is very important for you to know right now. Oh, this and this and this. But just by outlining, that's they equipped you to be where you are. Yes. No. The
Thank
important skills outlining.
Thank you so much for the questions. I'm passing over the mic to the speakers. Karibu.
Thank you so much for the very quite important question. Nana ameuliza sikumwona sura. Alafu nilisahau kitu kimoja. Ukiwa unajitambulisha, don't mention vyeo vikubwa Sawa? Hello. Watu takuogopa sana. We know, you know, mna organizations huko, whatever. Lakini ukija kwangu, don't tell me I'm executive director. Tell me your name and what you do. Sema Jonathan Alafu nitakuja mimi kuchanganua shirika lako baada ya kujua we ni nani. Sawa? Mkianza na vyeo vikubwa mtakosa watu wa kuwasaidia. Mmenielewa wadogo zangu? Hello. Sijamsema aliyesema ni executive secretary, lakini nawapa ujumbe wote. Amenikumbusha. Sema vitu vidogo, watu from your humbleness watakunyanyua. Tumeelewana So answering the question, what keeps me driving is the sense ambayo mtu alinishika mkono kunipeleka sekondari. Tumeelewana Yule bibi yule aliyenilipia ada, huwa nikimtazama na upendo wake, I keep going. Naendelea kuchapa kazi ili nami siku moja niwashike mikono watu. Nimekujibu? Au bado sijajibu vizuri? Lakini kingine ni kwamba neema niliyoipata kuwa hapa nilipo, it keeps me moving and driving forward. Thank you so much. So answering the question, ile ya skills, basically umesema ni skills gani ambazo tunazo za kutufanya tuwe hapa tulipo Kwanza I'm a good communicator. Which I knew I think I had all the skills. Thank you.
Thank you so much, Dr. Julieta. Over to you, Madam Felista.
Thank you. I don't know. Amesema the skills ambao kuwa nayo kabla. Lakini na mimi alipojua Juliet nimecheka kwa sababu I was like, for me I feel like I looked for those skills and I got it. So probably mimi ukiniambia ni skill ipi kufanya uendelee, that's the skill I can speak about it. Si ndio? Si mwenye swali yuko wapi? Au kwa ni sawa nikikujibu kwa hivyo? Kwamba skill ambazo zimefanya, the skills that has actually maintained on enabled me to navigate, that is okay? Yeah, because for me, it has been a journey of learning small things, as I said. For example, I have learned communication skills is very critical. You have to know how to communicate. Unaona? The second is facilitation skill. If you're supposed to facilitate, what are you supposed to know? This is also, like, you can learn. For me, I was trained on micro-teaching skills. That was a long course. I was trained on the facilitation skill, communication skill, but you have also to apply, not just learning and then you keep quiet. Negotiation skill. If you want to negotiate even for funds, you have to know how to negotiate with which donor. Donor differ. But negotiating is even with your friend. We normally talk, me, I'm a sexually reproductive health person. So negotiating is even safer sex. Isn't it? You need a skill to negotiate with your partner. Sindio? Lakini decision-making skills is critical. Unajua? So you know what to do. Now when I talk about, and then decision-making is also part of the life skills. Life skills kuna package ya kama skills zinasemagwa 100, lakini common ziko kama 10. Unaona? Yani assertiveness is one of the life skill. Unajua? Decision making, of course, is part of the life skill. And there are so many others which I don't want to take your time to say, but the critical ones, my dear, is hizo zisema. Communication skills, facilitation skills, negotiation skills, and the decision making skills. Lakini pia hata tunahitaji sana kujikuwa na skills advocacy. Because if you're speaking for other people who have no voice, you have to have the skill to speak on their behalf. Kwa sababu unaweza kukuta mtu anagombana, sio kwamba amekosea, lakini ile skill ya kufanya advocacy hana, amechagua hiyo ambayo ni ya mwisho labda, badala ya kuchukua ile simple ya kwanza. Maana unaweza kaenda mpaka kweli ya kugombana ipo, lakini that should be the last resort. Si ndio? I don't know if ni sawa nimekujibu. Thank you.
Thank you so much. Thank you so much. Personally, I really wish to spend...
Moderator, sorry.
Yes.
So next time, msio mnatafuta negativity. Tumeelewana Value your little skill you have. Usimulize mtu kitu gani ulikosa, ungetamani uwe nacho. Sikuwa nacho. Nilichokuwa nacho niliembrace. Tumefika hapa tulipo. Kwa hiyo msitafute vitu vikubwa na mlivyo nao vidogo mvitumie. Thank you so much.
Asante sana. Hiyo tumeichukua na tutaifanyia kazi. Personally, I really wish I would have spent the whole day mpaka saa 2 usiku with these vibrant ladies, because in just few minutes that we have given them, I have learned so much. So thank you so much for sparing your time and joining us here today. We really treasure and value your presence here. And before we wrap up for the photo session, I would like to welcome one of the steering committee member to come and give closing remarks, then wind up the day. Karibu sana. Hands of applause to our vibrant and dedicated coordinator. And if you don't know her, she is a doctor. Just as humble as you see her, she's a doctor. A young lady. Makofi jamani. Bila yeye pengine kwa namna moja au nyingine tusingeweza kufanikisha hili ambalo tumefanikisha. Karibu sana Dr. Pili.
Thank you so much. Thank you so much, Mariam. Unani hype sana hadi naogopa. Anyways, asanteni wote kwa kuwepo hapa. Loli yangu ni ndogo sana kufunga hii session. First and foremost, I would like to thank our sponsors. Girl Effect, and Abbott Fund. We have a representative from Girl Effect, Mr. Shaban. We thank you very much for your support. Kwa sababu we couldn't do all this by ourselves. You've been supporting us through the years financially and technically, so we thank you very much. Now, I would also take this opportunity to thank our speakers, Madam Felista. Asante sana. Madam Felista was my supervisor when I interned at UNFPA for 6 months. So she has been mentoring me and teaching me some ways. Kwa hiyo nikaona kwamba nisienjoy peke yangu vitu nilivyojifunza. Lazima vijana wengine pia muweze kukutana naye, awa inspire, lakini pia mjifunze vitu vingi kutoka kwake, right? Yeah. Dr. Juliet, we thank you very much. I know you came from a very long way from Dodoma, jamani kaja mpaka huku just for us. So thank you very much, Dr. Juliet. And to our facilitators, we had Mr. Jonathan Daly, who trained us on personal branding and leadership. I hope you guys really enjoyed the session and learned a lot from it. Miss Paula, thank you very much for taking us through the AI tools and all that. I hope kesho tukikutana huku kwenye corridors mtu atanionyesha, unaona hii ni link yangu ya portfolio yangu, vitu gani nafanya, right? Nadhani tumepewa hizo tools leo, tumejifunza vitu vingi, and we are now capable of doing that. If you still cannot, if you still have questions, please feel free to reach out to me. Unaweza pia ukakommunicate mle kwenye group, tutaweka contacts za our facilitators, mtaendelea kuwasiliana nao na kuconnect nao, right? Yeah, thank you very much for attending. I was very inspired by your energy and enthusiasm. Tokea tumefika, watu wote mko vibrant, inaonekana kabisa hii ni youth event. So I appreciate all of you, and I look forward to engaging with you in the coming days. Kama Mr. Shabani alivyosema, ni opportunity ambayo tumepewa wachache, so tutumie vizuri. Tiketi yako ya THS inakuruhusu kuingia kwenye forums kesho na kesho kutwa. Use this time to network, to engage with different people. Jifunze vitu vingi, angalia organizations, tuna organizations zinazo participate hapa zaidi ya 100. Angalia organization ambazo zina align na passion yako na interests zako. So if you're doing mental health, if you're doing non-communicable disease, if you're doing maternal health, all of it tunazo hapa. Kwa hiyo take your time to explore, engage and network. Thank you very much, and looking forward to connect in the future.
Thank you very much once again, Dr. Pili. That is very necessary. I remember I met Dr. Pili. By then, she was not a doctor, in 2023 at Niongoze Fellowship. It's a ladies' fellowship that young female leaders are trained from the universities to nurture their leadership skills. And by then, she was the humble one in the group, because we were about 10 of us. She couldn't speak, she couldn't talk, but when she had a chance to talk, she could speak facts. And in one way or another, for me, I may be so talkative, but our energies meet at the center. So she has always been inspiring me as well. I wish I could read her portfolio. And when I was telling her we need someone for the closing remarks, she said, no, I'm not going to talk. I was like, Pili, you have all that energy. You know, you're brilliant. Sometimes go, talk, speak, let people see you. But then I respect that people, we are different. So once again, hands of applause to Dr. Pili. And without further ado, I would like to thank each one of you for joining us. You have been here since morning until now. We are winding up. I hope we have learned, and whatever that you have taken, and it may be your portion, that you will apply it. And when we meet next time, probably you'll be such a different person. So thank you very much to each one of you dedicating your time. I know we are hungry. Rest assured, lunch will be served. And for now, I would like to call this the end of our YOCAB Program 2025 Tanzania Health Summit. And what is Gen Z without having photos? I know you're waiting for that. So with all honor, I would like to welcome our speakers at the stage for a photo session, as well as our sponsor, Girl Effect, karibu sana for the photo session. Gentlemen, please help us with the chairs. Thank you. Five are enough. Five are enough. Asante sana. Karibu sana. Our speakers, please join the stage. Okay, I'm gonna sit here, then tutaitoa and take the session. Msije mkasema moderator anajipendelea. Thank you so much. Now, I would like to call ourselves in group. As we did in the morning, we are going to start with this column, then that column, and until the end. So very quick, stand up, join us. You'll join us at the back. Remember to carry your beautiful smiles. Very quick, please. All is good, but I don't see the smiles. Okay. And do we have that energy, you know, Gen Z's? Yeah! Can we do that? A crazy one? Mnajibania. Tunawajua. Okay, the ones seated, we can spare them. But I know deep down you want as well. Thank you so much. The next column, please. Very quick. As usual, you look so beautiful, but you haven't carried your smile. Okay, say cheese. Interesting. Thank you so much. The third batch, please. Somebody's not smiling. Thank you so much. Our last batch, please welcome on stage. Okay, thank you so much. We can go back to our seats. Okay, if you can hear me, clap once. If you can hear me, clap twice. Thank you so much, DJ. Thank you so much. Thank you so much. If you can hear me, clap once. Okay, amazing. We are at the end of our session, and as I said earlier, it has been a pleasure having you all here. As you can see here, there is a QR code. Kindly, you are advised to scan the QR code so that you can share the feedback. If we reached your expectations, if you enjoyed, or what are you advising that the next YOCAB to be? So you can scan and share your feedback. Lunch will be served on the 3rd floor. So the moment you get out of here, you can go straight to the 3rd floor and grab your lunch. Thank you so much. My name is Mariam Survey. I was your conversation curator. We can link on social media. You can search Mariam Survey on Instagram, LinkedIn, and I'll happy to connect with you. Thank you so much.